On the 9th of March 2019, the people of Oyo State elected Engineer Seyi Makinde as the governor of the state, offering the topmost job to a man who had promised to serve and take Oyo State from poverty to prosperity. In his inaugural speech, Governor Makinde promised to focus on 4 cardinal programs: security, health, education, and expansion of the economy through agribusiness. He set out to work assiduously, and his best earned him the trust of the Oyo people in 2023 again, which led to his re-election at the polls. This time, at his inauguration at the Obafemi Awolowo Stadium in Ibadan, the state capital, on May 29, 2023, Governor Makinde raised the bar as he ushered in the Omitutu 2.0 lifestyle. He rolled out his plans under the Oyo State Roadmap for Sustainable Development 2023 to 2027. Two years down the line, it is time to run through the achievements of the administration, a breakdown analysis on key socio-economic indicators on what has changed since Governor Makinde assumed office. Governor Makinde's administration has prioritized the revitalization of the healthcare system to ensure accessible and quality medical services for all citizens. A cornerstone of this effort is a comprehensive renovation and equipping of 212 primary healthcare centers, while another 87 are at various levels of completion. The goal is to provide at least one functional PHC in the 351 wards across the state.
We have another provision which we call Basic Healthcare Provision Fund, and we have also another provision under what we call IMPACT, Immunization Plus and Malaria Transforming Progress and Transforming Services. Under these, 106 primary healthcare facilities that have been fully completed or fully upgraded under Omitutu 1.0 are to be revitalized. And what are they doing in terms of revitalization? They were to make them to what we call Category 2 or Category 3 primary healthcare facilities. And for Category 2, Category 3 primary care facility, one of the criteria is to have staff quarters. We chose another 66 primary healthcare centers, which is to be 2 per each of the local government areas that we have, 2 times 33, making 66. And for these 36, what we see common in them, if you move around, you are going to see a 10 kVA solar inverter system, which can offer 24-hour service uninterrupted electricity supply in the facility. We are going to see red brick incinerator in them. We are going to see 2 units of tablets for electronic medical records. Gone are the days where we use paper. We want to upgrade now so that we can have access, so that by the time we are operating under electronic medical records, if you need an information to cascade to secondary healthcare facility, easily you can send the information even before the patient reaches the secondary healthcare facilities.
Before federal government, our ni abere pe functional primary healthcare facility in each ward, and 354 of them. Yeah, we're happy. The structure at the federal level to allow where much progress go on some of the major areas. Alefoni template of your state. It has worked here. It will also work at the federal level.
The state has been deeply affected by a shortage of medical personnel. So, to address this, the government recruited doctors, nurses, and other healthcare professionals, enhancing service delivery in both primary and secondary health facilities. The establishment of pressure swing absorption (PSA) oxygen plants at Jericho Specialist Hospital and State Hospital Oyo has significantly improved emergency response capabilities.
We also see pulse oximeter. A child is coming breathless and it needs to be resuscitated. So we have pulse oximeter to be able to tell us the saturation, the oxygen saturation in room here. And then oxygen cylinders, field oxygen cylinders are there. You can go and verify. If they don't have oxygen cylinders, that means they are flouted to the room. Because at every point in time, the cylinders must be filled with oxygen, because no one knows when a child will come or a pregnant woman will come that we need oxygen. So we have this across our health facility.
To strengthen healthcare financing and accessibility, the administration of Governor Makinde has also increased enrollment in the Oyo State Health Insurance Scheme from 45,000 to over 300,000 beneficiaries. Additionally, the implementation of a drug revolving scheme in the primary healthcare centers ensures the consistent availability of essential medicines. Oyo State Hospital Management Board also got the mandate of His Excellency to recruit new staff in order to improve the working strength and serve more people in the state without undermining the quality. Let's not forget the free medical outreach program. This outreach takes medical care to the doorstep of the people at no cost to the residents. The state government has recorded successes with Omitutu Free Medical Mission, which has reached hundreds of thousands of residents across the state. These concerted efforts have yielded measurable outcomes, including a reduction in maternal mortality from 296 to 244 per 100,000 live births, and an improvement in neonatal mortality rates.
Permitting to live major life-saving or quality of life improving interventions that some of our enrollees have enjoyed in the last 1 year. 261 cesarean sessions done, 195 cataract or eye surgeries done, 147 myomectomies, 9 Horiv procedures, 18 thyroidectomy, 12 laparotomy, 13 prostatectomy, and 1 open heart surgery done. Apart from providing access to improve quality of healthcare, the agency, through payment of capitation to various accredited hospitals, has contributed significantly to the efforts of Oyo State government in repositioning our hospitals for better service delivery, especially at the primary healthcare level.
For women who are using modern method of contraception, all these were put in place for us to be able to reduce our maternal mortality as well as undefined infant mortality. Because if women they were able to space their children, we won't have issues of mother having complications during childbirth, and that's why the reform of family planning, so that we can address child spacing. And by the time the mother is giving birth to another child, you are sure that that child is okay and well enough in terms of nutrition, in terms.
You hustle and struggle to make a living, yet the evil one in some people could suddenly crash your dream. 615 and the emergency response team will be there.
Or call 090 7449 1249 or visit Oyo State Crime Alert platform.
The Oyo State Governor, His Excellency Engineer Sheyi Makinde, says a big thank you for your support to keeping the Bayelsa State safe and secure.
Under Governor Makinde's leadership, Oyo State has witnessed significant infrastructural development aimed at enhancing connectivity and stimulating economic activities. In the last 2 years of Omitutu 2.0, this administration has delivered 368.9 kilometers of roads, building on the enviable foundation it laid during the governor's first term by building roads that connect all zones of the state and improving inner roads. These key projects include 65-kilometer Monia-Ijaye-Iseyin and 76.7-kilometer Iseyin-Fapote-Ugbomoso Road, the 34.85-kilometer Oyo-Iseyin roads, the ongoing 110-kilometer circular road, rehabilitation and total asphaltic overlay of 16.96-kilometer Kolakbo-Ishola-Jiare Road network, amongst
deliver high impact, durable and cross-functional roads hydraulics with improved public infrastructure and transportation system.
Urban mobility has been improved through the rehabilitation of major roads in Ibadan, such as the Dugbele Road and the Challenge Orita Road, reducing congestion and facilitating trade. The commissioning of the Challenge and Ojo bus terminals, along with the introduction of Umitutum buses, has modernized the state's transport infrastructure. The Iwo Road bus terminal is another mega project of this administration. Work is seriously underway. From all indication, the contractor is putting final touches to the project, which is set to redefine the transport system of Ibadan. The state government has also begun to deploy technology towards making the transportation sector more orderly with the introduction of spike system to curtail one-way driving. Makinde's popular mantra, "Where roads go, development follows," has been justified by the high volume of businesses and investments coming into the state.
Immediately we're done with the inner city of Ibadan. The next place to go to is the zone of Ogbomosho and Oyo.
When we came into office, I remember stating in my inaugural speech that depending over 60% on FAC allocations was unsustainable. So I promised that we will take actions that will put Oyo State on the path to sustainable development. Our projects and policies have ensured that Oyo State economy continues to grow. Where road goes, what should follow? Development. This is the mantra that has supported our continuous drive to build road infrastructure that interconnects all the zones of our dear states. Back in 2021, we started with the commissioning of the 65-kilometer Moniya-Ijaye-Isheyin Road. Our focus has always been to ensure that we spread development all around.
Everybody hands up! Get on the floor! Now!
Emergencies can happen anytime and anywhere. What would you do? How would you protect your family when it's just you and your family at the most critical moments of the night? What would you do in times when fire is everywhere? When nature is at its worst and things are beyond your control? Who do you call? You can call the Oyo State Citizens Inquiry number 615. Call is free at any time and the emergency response team would be there to rescue you. The security of life and property is a topmost pillar of priority to the government of Oyo State. The Oyo State's Governor, His Excellency Engineer Sheyi Makinde, says a big thank you for your support to keeping the pace at the state safe and secure.
In the energy sector, the commissioning of 11-megawatt hybrid power plant combining gas and solar energy marks a significant step towards energy independence. With a target of achieving 500 megawatt capacity, the installation of solar mini grids in various communities and solar lights at 21 primary healthcare centers ensures reliable electricity supply, particularly in off-grid areas.
We've been able to power or energize our highways through the light up Oyo State and equally through the street lighting, solar light, which we have improved. And of course, as I speak now, we have about 1,300 all-in-one solar street across 50 markets and garages, hospitals, and various places across Oyo State. We have equally supplied the electricity to our air care facilities. We have equally identified some priority areas which we believe were in place. We need to sustain it so that we have competent hands that will help us to do what I call operation and maintenance of this.
Makinde's 6-year tenure has been marked by strategic reforms and investments that have transformed Oyo State across multiple sectors. His administration's focus on healthcare, education, security, and infrastructure has laid a solid foundation for sustainable development and improved well-being of the state's residents. As Oyo State continues on this trajectory of progress, the achievements of the past 6 years serve as a testament to effective and people-centered governance.